Breaking. Federal government considers arrest of medical doctors over 540 million training fraud. Fraud even in the medical profession or with the medical doctors. Okay. The federal government is considering dragging some medical doctors through the Economic and Financial Crimes Commission (EFCC) and the Independent Corrupt Practices and Other Related Offences Commission (ICPC) for illegally collecting medical training allowances meant for house officers on residency training program in 2020 to the tune of 540 million. Man humanity to man. The move came as this day learned that the government had released 4.8 billion for the 2021 residency training program. Reliable source at the Federal Ministry of Health and Federal Ministry of Labor and Employment told this day at the weekend that the Health Ministry was considering reporting the doctors who failed to refund the illegal payment to the Treasury to the anti-corruption agencies. The source says there were three categories of medical doctors, medical officers involving in the scam, including some consultants, doctors. The sources also said the government had accused the management of some of the teaching hospitals of illegally smuggling names of those who have completed their residency programs into the list of house officers that received payment from the Medical Training Fund in 2020. According to the source, though the affected doctors had promised to refund the money, they were yet to do so, thereby making it difficult for the ones due for the training to access the allowances. But this is not fair. This day gathered that the federal government was particularly concerned that some of the consultants doctors who were involved in the illegal deal had not shown remorse for their actions, but rather were among those collaborating with resident doctors on the ongoing strike. No wonder they want to cover their dirty deeds. The source also disclosed that out of the 8,000 house officers that applied for the 2021 residency training program, 2,000 were screened out of for not having postgraduate residency training numbers. The source said verification was ongoing to ensure that only those qualified were deployed for the next program. According to the source, the Federal Ministry of Finance has released 4.8 billion as this year's residency training fund to the Office of the Accountant General of the Federation 2 weeks ago regarding the smuggling of names into the salary payment platform. The source said the federal government had issued queries to the chief medical directors of the federal teaching hospitals involved in the illegal act. About 205 doctors were allegedly to have been illegally recruited at the Ibadan Teaching Hospital, while the Calabar Teaching Hospital carried out illegal recruitment of over 100 doctors out of the 500 health workers. According to the source, these illegally recruited doctors and health workers formed the majority of those that the NAD leadership were demanding the government should pay before they would end their ongoing strike. The source says these CMDs went ahead to recruit new doctors and other health workers without relevant approvals and ignoring the federal character principles. They went further to smuggle their names into GIFMI's salary payment platform. Teaching Hospital Ibadan recruited over 950 health workers without waiver from the Office of the Head of Service, without certificate of finance and manpower compliance from the budget office of the Federation, and without compliance with the federal character principle. These illegally recruited doctors and health workers were among those that NAD is demanding the federal government must pay salaries. This amounts to arm twisting of the federal government and cover up of fraudulent act, and it will not happen. The federal government, in its magnanimity, despite the ongoing strike, have decided to pay these illegally recruited doctors and health workers by asking the head of service of the Federation to approve a waiver for the affected doctors. to be recruited formally into full employment. The Budget Office of the Federation is now working to capture them into the budget to be paid through the service-wide vote. But in a statement issued at the weekend and made available to this day, former President of NAT, Dr. Muhammad Askira, accused some government officials of deliberately delaying the grant of waiver for recruitment or replacements of medical doctors and other health workers in the federal government health institution. Part of the grievances of the striking resident doctors was that their members were being owed several months of salaries and allowances by federal and state governments. Askira, while justifying the current strike by resident doctors, said this was as a result of the government insincerity in implementing agreed actionable series of memoranda. He alleged that there was currently a dearth of medical manpower in healthcare institutions caused by unnecessary bureaucratic bottlenecks. Askira alleged that the country presently had a doctor-to-patient ratio of 1 to 7,000. This is alarming, adding that many hospitals are finding it difficult to recruit or replace doctors. According to Askira, many doctors are leaving the country to other climes where they can do their job with satisfaction. He said, as a result, the hospitals are depleted but find it difficult to employ new staffs because of bureaucratic processes that involve the budget office of the Federation, office of the head of service, civil service of the Federation, the Federal Character Commission, as well as the Federal Ministry of Health. This has made the work burden on the available doctors to be unbearably high, resulting in physician burnout and limited care to a limited number of people needing care. Writing on the alleged rot in the health sector, Askira said the process of recruitment or replacement of medical staff was incessantly delayed for no just reason. He accused the Federal Ministry of Health and all the other agencies that it takes average of 8 to 12 months for a local hospital to finally obtain a waiver for recruitment or replacement of medical staff. But the Minister of Labour and Employment, Senator Chris Ngige, has debunked this claim, contrary to the claims by the striking member of NAT. No genuinely recruited doctor or health worker in Nigeria is being owed monthly salary. No doctor, nurses, pharmacists, or any other health worker, including the driver, is owed monthly salary. The government pay as I want to. The truth is that NAD doctors fail to tell Nigerians that their colleagues who are owed salaries are the ones illegally recruited and were therefore neither captured by the office of the head of service of the Federation, nor was their payment provided for by the budget office of the Federation. Wow, this is not surprising at all because this is Nigeria. Anything goes. I cannot imagine that with all the CMDs that we have, with their relationship and the medical doctors that we have on ground, the professional bodies, the MB, the Medical Association, and all their professional bodies that they have or association, why can't they follow the due process to get things done right? Why must they circumvent things? And these are professional for God's sake. Because I always say this, that when people or group of people are shouting, this is not good, that is not working, try them with money or you will see their true color. I cannot imagine people collecting illegal money and when the government discover they are not ready to reform. My people, viewers and listeners, what is your own take about this? Kindly make your opinion known. What they did, was it right? Why are they denying others of doing their job? Why are they putting everybody on the same table when there is something that they need to remove or clear within the association? Kindly make your views known. Kindly like, share, and subscribe. Thank you. Good day and God bless.